welcome back to the Dave K Show. I'm David K. Gyro, and we're glad you joined us this evening. And if you just joined us, we are here in the studio with Dr. Paul Rachal, and he needs no introduction out here in the Neuros and Pointe Coupee Parish area. And we have a med student that's with him for about a year now, Dr. Valerie Cagle. And Valerie, Dr. Valerie, we're happy to have you with us tonight. Of course, Dr. Rachal, same to you. We've been discussing diabetes, all of the causes and effects of diabetes, and the complications, what to look for and everything. And on the second segment of our show tonight, we're going to kind of take it a little bit further as far as recommendations and things to look for, and we'll go down the list. So Dr. Rachal, if you want to go ahead and continue.
Sure. As we take care and work with diabetics, I think it's important to involve patients involving in our community, involve other healthcare workers that we need to use to get their sugar under control, their blood pressure under control, and also to screen for the diseases that could hurt them. So we always love to use our dietitian here at the hospital. Bach has also helped out with dietitian recommendations too.
Okay.
With that, and so
which dietitian do you recommend or you use
at the hospital? The phone number is 638-5717. It's
okay, good.
Courtesy.
Very, very good. Okay.
Your staff at Pointe Coupee has made it a courtesy, so it's great to go in and get education.
And that phone number one more time.
638.
Okay.
5717.
Gotcha. Okay.
And there's also a diabetic teaching nurse at Pointe Coupee Homebound that's available also for our use with her too. So Miss Janine, and she's been wonderful in helping to re-educate our patients into the foods and goals and exercises with that.
Great. Very good.
Having, as a diabetic, if they can walk, having a walking partner, having a healthcare associate, right? Number one.
Right.
They'll also make sure that, like I said, as we go down the line from top to bottom, as we look at it, I do think once a year every diabetic needs to see an eye doctor to get a dilated eye exam to look at their retina. Okay, once a year with that.
Right.
Then also involving, like I said, someone to take a look at their heart with a treadmill or nuclear treadmill. I think is important to take a look and see what's going on deep inside that we can't feel or hear. Okay?
Right.
Through ultrasound techniques that can be done through carotids and also ultrasounding of the legs, we can look at peripheral vascular disease. Okay.
Right.
And then that needs to happen not necessarily on a yearly basis, but every couple of years for sure. Okay?
Right.
When the diabetic is coming into our offices, we always want to check their weight, check their blood pressure, check for those signs and symptoms that we mentioned about, that frequency of urination, that blurriness of vision, how is the skin doing.
Right.
And then we also check for feeling in their feet with little monofilament tests, almost like fishing line. Can they feel? If they can't feel, then they're in danger of hurting their feet.
Right.
And so setting them up with appropriate diabetic care and also appropriate exercises, okay?
Right.
A diabetic who can feel with their feet can do simple walking. Those that cannot, they do recommend things like non-weight-bearing exercises like exercise bikes. A good way to keep their exercise up on a daily basis, with that. Okay?
Very good.
And then, like I said, as we measuring for their cholesterol, these are, as we said, we'd love to get a fasting blood sugar less than 110. We'd love to keep that bad cholesterol, the LDL, less than 100, and probably keep the HDL, the good one, that cleans up the blood vessels, near about 50. So those are good goals to set with that. And same thing for our top number on our blood pressure, about 120 would be great.
Okay.
So those are our goals when the patient comes in that we set for them.
Right.
And
very
then
good.
following them up probably periodically about every 3 to 4 months, once they're pretty stable, to make sure those guidelines are met. And then you can extend it from there.
Okay.
Vaccines. This is flu. We're starting with flu shots this past week at the office and other offices. So every diabetic needs a flu vaccine, an injectable.
What does the flu season consist of? Is there like approximate ending and beginning time for it?
In Louisiana, the flu season is usually started for the most part middle of December through about mid-March.
Okay.
Most of the times, let's say right after Christmas has been pretty profound effect with that.
Okay.
It takes a flu vaccine about 2 weeks once you have an injection for it to work.
Okay.
So as I tell patients, they last about 3.5 to 4 months.
Okay.
So getting them from now forward will allow it then to work during that time period.
Right. Right. Of course, who would be more likely recommended to have a flu shot as opposed to other people?
Yeah, diabetics number one would have a flu shot. Okay. With that, pregnant women should get a flu injection.
Okay.
People above 49 should always get it as a shot.
Okay.
They also make it as a spray, and a spray with it called a flu mist, which we're using for children and adults up to age 49 from 3 to 49.
Okay.
Infants less than 36 months need an injection.
Okay.
With that. as well as, like I said, anyone diabetic or asthmatic needs it.
I'm sure the kids rather the spray than a shot too.
They much prefer the spray. A spray with that. So, and then we also want to update their tetanus shot. Okay. With which now has pertussis in it, and then also their pneumonia vaccine to update it for them, because the immune system of the diabetic is at a little bit higher risk. They can't fight off infections quite as well as the regular population.
Right.
With that. So,
right. Very interesting.
So.
Okay. Well, with Dr. Cagle, you have some information coming up for us about a health fair coming up. Maybe get us kind of up to date on that.
Yes, the Pointe Coupee Parish School District is hosting a health fair to be held in December.
Okay.
On December 4th at the Scott Civic Center.
Okay.
From about 9 in the morning until 4 in the afternoon. We're planning on offering all kinds of screenings and health services. We're going to have the dental van there.
Great,
for the
very
kids.
good.
I'm hoping to offer free haircuts for the kids.
Really? Okay,
live entertainment.
That's good.
Taste testing of healthy foods.
Right.
I'm even hoping to have a teddy bear clinic for the kids to bring their teddy bears.
That's great. Very good. And once again, like I said, it's anybody that might be thinking they're having some maybe pre-diabetic symptoms or whatever, this would be a perfect time and opportunity for you to go out there and get tested.
Absolutely. It'd be a great day. It's for all members of the Pointe Coupee Parish community, everyone.
That is great. So generally speaking, how is this, because, it's an annual thing, I would imagine, right?
Traditionally, the hospital has hosted the annual health fair. This year, the school district has taken it over.
Okay.
So our target audience is the children of Pointe Coupee Parish and their families.
Right. Get them started when they're young. Great.
Right.
Very, very
Exactly.
good. How has the health fair fared in the past? I mean, has it been pretty successful? You had a lot of people come out? Do you know?
From what I've heard, yeah, we've had about 300 people come out.
Really?
In the hospital. So we're hoping to get, about the same number. We're hoping that.
That is great. I'll tell you what, ladies and gentlemen, there's no reason why you should not go to something like this. It's offered free. Is that correct?
That's right.
I mean, it's offered free. I mean, just get in your vehicle and go and definitely get the free tests that are offered and everything. Make sure you get those and see if you're, if you're healthy like you should be or whatever. Well, very good. Well, Dr. Cagle, I just kind of want to ask you a few questions, and of course, anybody out there that's watching, that's patients of Dr. Rachel's, you're going to see her, of course, in the office, I'm sure, right?
Yeah.
So, are you enjoying working with Dr. Rachel, or?
I am. He's been gracious enough. I'm actually a member of the Tulane Rural Immersion Program.
Okay.
We're in our pilot year. 3 students, third-year students, were selected to go into rural communities and do our core rotations.
Okay.
So, peds, family medicine, surgery, all within rural communities.
Right.
So Dr. Rachel and I are one of the first participants in this program, this new program at Tulane, and
great. I'll
be with him until next May.
Have you done any rotations in a more urban setting, like a big city, as opposed to rural?
I have, yeah.
area?
When I first started my 3rd year, I did some inpatient work at Our Lady of the Lake in Baton Rouge, and also at Baton Rouge General.
Okay, all right. This kind of off the cuff, whatever. Question I thought of, but I mean, have you seen any differences in practicing in a rural setting as opposed to a big city? Are there any differences?
Oh, definitely.
Really?
What I found in the rural setting is it's much more personal. The healthcare, it seems like the provider knows their patient,
right,
and has known them for a long time. So what we do in the office is much more tailored to the individual. And,
right.
Even when I'll work with him in the office, but then I'll do a shift in the emergency room, and sometimes I'll see my own patients I take care of in the office come into the emergency room, and I know them by name. So it's pretty cool. I found it to be a wonderful experience so far.
That's great. That's great. That's one of the benefits of living in a rural area like this, especially for an extended period of time or whatever. So, well, very, very good. Y'all have any last-minute comments or ideas or anything? Or?
David, we're glad to see this program take off. It's a good way for, like I said, people to know what's going on in the parish.
Great.
And in other words, thank you for inviting us in.
Sure, and my goal is with our show is to showcase people like yourself, people that are real important in our community and that really are making a difference. And we want to get this extremely important information out to the public so they can benefit from it. Okay. So, well, Dr. Rachel and Dr. Cagle, glad to have you with us this evening. And we're definitely going to have y'all both on very, very soon, I promise you.
Thank you, David.
Okay, we're going to be back after these messages on the Dave K Show.